Hello, my name is Eric Sisemore, and I will be your case manager today. Come in and have a seat. I have a few questions that I'm going to ask you today, and then we'll do a small assessment, kind of figure out what we can work on today. So if you could just answer these questions as honestly as you can for me, I would really appreciate it.
Okay.
All right, we'll start with just the basics here. What is your name?
Nicole Jackson,
All right. What address are you currently at?
31 DV Lane, Rossville, Georgia, 30741.
And what is your home number?
423-855-5555.
Alrighty. And if we needed to get in touch with somebody, who would be your next of kin?
Brian Jackson.
And how is he? Is he related to you?
He's my father.
He's your father. Okay. And what is his address?
31 DV Lane as well.
Okay. And can we get a phone number for him?
423-637-1234.
Alrighty. Got a few more questions here for you. What is your date of birth?
10-3-81.
And your marital status?
Divorced.
Divorced. Okay. Do you have any children from that?
2.
And do they live with you?
No, they live with their father.
Okay, they live with their father. Okay, let me make a note here. All right. And what is your education level?
I have a high school diploma.
High school diploma. And your employment status right now?
Unemployed.
You're unemployed at the moment? Are you currently pregnant?
No.
Are you receiving prenatal care? Well, I
No.
guess you are if you're not pregnant. Okay. Do you have any current medical conditions that we should know about?
Nope.
Taking any current medications?
Nope.
All right. And your legal status?
Probation.
You're on probation? Okay. And what are you on probation for?
Drug use.
Okay. So you have a substance abuse problem?
I do.
All right. And what substances do you use regularly?
I use meth, alcohol, and some benzos.
Some benzos? Okay. And is that the reason for your visit today?
The reason for my visit is I'm mandated to be here to undergo assessment and or treatment.
Alrighty. And you're not on any medications at this time?
No.
Okay. Are there any, can we contact these numbers that we have here for you?
Yes.
Okay. Have you undergone any recent psychiatric evaluations
No.
or psychological evaluations? Okay. Okay. So you said that you had 2 children. Can you tell me a little bit about that?
I have 2 kids. They live with their dad. I don't have custody of them.
Or visitation?
Or I don't have visitation rights.
You don't have any visitation rights either?
No.
Okay. And how long have they been with their father?
2 years.
2 years? Okay. And what brought that about? Did you leave him? Did he leave you?
I left him.
You left him? Okay. Did it have to do with your substance abuse?
It did. I couldn't stop using, so I left and left the kids with him.
Okay. When you say you have a substance abuse problem, what does that look like? How did that start for you?
I was a bartender at a nightclub, and I started drinking, and then I started drinking even heavier, and I got to where I couldn't stay awake at work, so I had a customer offer me some meth one night, and I took it.
Do you feel like you had a problem with meth in the beginning?
Yeah, kinda.
Okay. Was it gradual or
No.
started using right off?
Yes.
Okay. And how do you use the meth?
I shoot it up.
Okay. If you shoot up, I would recommend that we do. I would recommend that we get you checked for HIV and hepatitis C. There's a lot of dangerous diseases out there from using IV drugs. So we'll definitely refer you out to Chattanooga Cares if that's okay with you.
Well, I don't think it's necessary, but if you do, okay.
Well, it will be no cost to you. Chattanooga Cares usually takes care of their clients.
Okay, if you think that's what I need to do.
Alrighty. Well, I think that you've been very open and honest with me. I'm going to ask you a few more questions, and I hope that you can be as honest with me as you can be. I want you to know that it will not leave this room. So, have you ever been sexually abused?
No.
Never been sexually abused?
No.
Okay. Have you have any suicidal ideations?
Yes.
So you have had suicidal ideations?
Yes.
Okay. Do you have a plan if you were to commit suicide?
I would take a bunch of pills.
Okay. Do you have access to those pills? It says you're not currently on medication.
No, not at this time, I don't.
Okay. Do you feel suicidal at this time?
No, I don't.
No. Okay. Can you promise me that you will not hurt yourself before our next visit, which is scheduled for 2 weeks from now?
Yeah, I promise.
Okay. All right. Well, you seem like a very intelligent person, and I'm wondering if we can get you a psych evaluation done at Lookout Mountain Community Services. Can maybe get you on some medication to level you out. I'm wondering if we could also maybe get you in an IOP, intensive outpatient program at Carter Hope, maybe until a bed becomes available for your treatment services. And would you be opposed to those things?
No, I wouldn't.
Well, it does mandate you here for treatment, but I'd always ask if you would be opposed to it. We like the patient to go on their own free will as well. Alrighty. Okay, I see here that it says you live at your father's residence. Would you consider that a safe and sober place?
It's a safe place, but not a sober place.
It's not a sober place. What does your father do?
He drinks.
He drinks alcohol?
Yes,
And do you drink alcohol with your father?
I do.
You drink alcohol with your father. Okay. So when you go to your father's house, do you use meth?
No, I do not.
You don't use meth there?
No.
So do you go to your father's house to detox?
I do.
And when you detox with your father, you detox on alcohol?
Yes.
Okay. If you're unemployed, how do you get the money or the drugs?
People just give it to me.
Okay. I'm not trying to be rude, but in my experience, I've never known anyone to just give away those kind of things. Do you ever trade sexual favors or anything like that for your drugs or money?
Sometimes.
Okay. Would you consider yourself a prostitute?
No.
No? Okay. All right. Well, they can still take care of all that for you at Chattanooga Cares. Like I said, we can get you tested for everything there. If for some reason you have something, they can help you pay for your medications. I'm gonna refer you to Lookout Mountain Community Services for your evaluation. And we're going to get you started in IOP until a bed becomes available. I really feel like in-house treatment is the best thing for you right now. At this place that I want to refer you to, you will actually live there. It's not a lockdown facility, so you don't have to get upset. You can go out and get a job once you're there. I think one of the things that would help you out the most is getting some self-worth in your life. I think that would be really well for you. And if we could get you leveled out, we could get you a job, and we could get you clean, what would be the goals you would like to work on?
I would like to see my children and get sober, find a job, and maybe go back to school.
Okay, those are some good goals. I believe that if you work hard enough, we can get you sober and clean. And the rest of those things kind of fall into place usually. I think we're going to set some goals for you to maybe get you some on-the-job skills, some training, or maybe get you some secondary education. What kind of field would you be interested in going into?